Hey everybody, it's Dr. Galvin with a post-ER night shift coronavirus update. Things in the emergency department here in North Carolina are still a little insane. I've been practicing emergency medicine for a long time. I've never really seen anything like it. We are getting bombarded with COVID patients. Back, a few months ago, we would see COVID on a regular basis, but now it's, 30% of the patients we're seeing have something to do with COVID. And we're seeing more and more really sick people come in with COVID, requiring kind of ICU level care. And the problem with that is, like, at our hospital right now, we don't have any ICU beds, none at all. I was told you need to transfer those, and I called to several of the major medical centers, the tertiary medical centers, teaching hospitals locally, and was basically told we don't have any beds. So we've got now multiple critical ICU type patients being boarded in the emergency department, which is not ideal because it's not in the ICU, and the ICU nurses don't have easy access to those patients, and we're waiting for things to move around, and sometimes in the morning things will loosen up and people will be moved from the ICU to maybe a lower level care, and some of these people will move up. But it's very, very unusual, almost never heard of, to hold an ICU patient in an emergency department, because typically if you're that sick that you need an ICU, you need to be in an ICU someplace. And so if we don't have a bed here, we immediately transfer you to someplace that does. But we're running into the problem now is that there are no places to send other people because all the other ICUs are full. We had another 250,000 cases yesterday, more than 2,900 deaths, or maybe more than 3,000. I can't remember what it was exactly yesterday, but we lost around 2,900 people on 9/11, and we're essentially losing that number of people every day. So for those folks that I keep getting sent posts that say, oh, where was the, I have a chiropractor locally that's been posting, oh, where was the surge that they warned us about for Thanksgiving? And I'm looking around going, are you not reading the paper? You want to, I don't know what people are thinking. They're in this little bubble where they don't see what's really going on. What's really going on is that we've got a real crisis on our hands, and the hospitals are getting overwhelmed. And honestly, getting tired. My nurses are getting tired. My techs are getting tired. My respiratory therapists are getting tired. It just, it doesn't ever end, and it just keeps getting kind of worse and worse and worse. Now, we're all pretty excited about the vaccination being available. They're starting to give the Moderna vaccine, I think, here tomorrow. They've already started using the Pfizer one. I'm trying to get signed up for it to get that process started, because, it's two doses, 21 or 28 days apart, depending on what's going on. People keep asking me, Doc, you going to get the vaccine? Well, yeah, I'm going to get the vaccine. I actually did an antibody test on myself on Monday, figuring, hey, I've been exposed to COVID hundreds of times now. Maybe I got it and I was asymptomatic, but guess what? My antibody test was negative, so I still have not caught COVID miraculously. But the fact of the matter is that we wear these every day, and none of my staff have gotten sick in the hospital. Everybody we know from the hospital that's gotten sick has gotten sick invariably from somebody in their family or someone outside the hospital, because guess what? Washing your hands and wearing a mask like we do in the hospital actually works pretty well to prevent it. And myself and all my partners and all my staff members that have not got COVID, despite taking care of many, many COVID patients, is pretty good evidence to that effect. Little coronavirus news. There was a story out of England that they've got a new strain of the virus that is more contagious. I read one place where it's 70% more contagious. So they're increasing restrictions in England because of that. There's no word yet whether there's any increased mortality. So just because it's easier to get does not mean it's more deadly. With travel sort of shut down between every place, there's a reasonable chance that strain will not make it to the U.S. Usually the travel is so open worldwide that it's easy for a strain to move from one area of the world to another area. But right now, hopefully they'll be able to keep it confined to England, and we won't have to deal with that. I am exhausted. I'm going to call it quits there. Just be aware that, a lot of what we're seeing now is related to Thanksgiving. We've got Christmas coming up, and we all want to be together with our families. But remember, Christmas is a longer holiday, and many people I know are planning on getting together with families. And remember what happened at Thanksgiving, and we are looking at really significant case numbers in mid to late January related to Christmas gatherings. So please be safe, and especially protect those people in your family who are vulnerable, the older folks, people that are immune compromised, that have chronic medical problems. If you've got those folks in your family, it may be the year to have a Zoom Christmas, at least with those people at high risk. Because one thing I've learned from now having knowing many people have had COVID, and having lots of friends that have had it, it is very contagious. And it's not uncommon for one person in a house to get it and give it to everybody within a day or two. So just be careful. I know you've got to get together, you want to get together, but use your head, use some common sense. We're kind of getting to a point where, the vaccine's available. If people start getting it, this will become less of an issue, and hopefully next year we'll have a nice normal Christmas. But be extra careful this Christmas. As usual, look out for yourselves, look out for your families, look out for those around you, wash your hands, wear your mask. I'm working a couple nights in a row, so I'll do another update after my next shift, either tomorrow or the next day. Good night.